Here we are exploring one of the most crucial aspects of ECG interpretation, the ST segment. This segment is a key player in diagnosing various cardiac conditions, including myocardial ischemia and myocardial infarction. ST segment is the flat section of the ECG trace between the end of S wave and the start of the T wave. It represents the period between ventricular depolarization and repolarization. ST segment tells us about the condition of the cardiac muscle. In a normal healthy heart, this segment is usually flat, aligning with the baseline of the ECG. The reason for being flat in a normal heart is the fact that all cardiac muscle cells normally synchronously depolarize together and repolarize together. In conditions like myocardial ischemia, where the cardiac muscles are not getting sufficient blood supply, or myocardial infarction, where there is a complete blockage of the blood flow to a certain part of the cardiac muscle, causing damage to this part of the cardiac muscle, in that case, the damaged cells will depolarize and repolarize differently from the healthy cells. Damaged cells usually repolarize earlier and depolarize later than the healthy cell, and that causes deviation of the ST segment. T elevation is observed in condition of acute myocardial infarction, which is commonly known as heart attack. In acute myocardial infarction, a part of the cardiac muscle is not receiving enough blood and oxygen, leading to damage to this part, which is known as infarction. ST depression can suggest conditions like myocardial ischemia, where the heart muscle is not getting sufficient blood supply. The cardiac muscle is suffering from the lack of oxygen, but not damaged yet. That is the difference between ischemia and infarction. So the situation in ischemia might not be as immediately severe as an infarction. The magnitude of ST segment deviation is measured from the J point or junction point. That is the point on the baseline of the ECG trace at the end of S wave. So we can measure the elevation in millimeter, and 1 millimeter refers to a small square in ECG. So we can say, okay, ST is elevated by 2 millimeter or 3 millimeter, or depressed by 2 or 3 millimeter.